thinking about how we can prolong, responses or induce deeper responses, I think the new cadre of clinical trials are going to be looking into combinations and specifically trying to use BTK inhibitors in combination with other agents to actually be able to produce these deeper responses that we're so much looking for. So when you think about other conditions in the world of hematologic malignancies, like, chronic lymphocytic leukemia or multiple myeloma, we're talking about complete responses with MRD negative complete responses. That is a concept that we have not really seen in Waldenstrom's. Complete responses in Waldenstrom's with BTK inhibitors, almost never see that. And even with chemoimmunotherapy or proteasome inhibitors, we do see some complete responses, but the rate is very, very, very low. So we still have to get to the complete response. I think that's probably where everybody in the world of Waldenstrom's is trying to get at. There are treatments in which clinical trials that are ongoing that are combining Ibrutinib with all the agents that I just mentioned. So Ibrutinib in combination with chemoimmunotherapy, there's a study that is ongoing in Europe. Ibrutinib in combination with proteasome inhibitors, there are a couple of studies in Europe. There's another study in the United States looking at these combinations and actually looking at Ibrutinib in combination with other agents. One of the important aspects, for example, is the presence of CXCR4 mutations in patients with Waldenstrom's that can be a little bit more resistant to Ibrutinib therapy or BTK inhibitor therapy. So there's an anti-CXCR4 agent that called Mavorixafor that we're actually combining with Ibrutinib, seeing if we can actually induce deeper responses in patients with CXCR4 mutations. The anti-CD38 antibody that extremely effective in myeloma didn't seem to be as effective in Waldenstrom's as a single agent, just a 23% response rate. We published those data last year. But there is a study combining Daratumumab with Ibrutinib, and maybe a deeper response could be obtained from that combination. There's an agent approved already for CLL called Venetoclax. It's a BCL2 inhibitor. And we do have very encouraging data as a single agent as well. So we're combining now Ibrutinib and Venetoclax, hoping that is going to improve, deepen the responses on these patients and also provide longer responses. So we are trying to, keep that delicate balance between inducing a response that will favor progression-free survival while keeping the quality of life of the patients and without affecting that, in a significant manner. So it's a delicate balance to keep to try to make patients feel better the longest.